Welcome! Today, we're diving into the early warning signs of endometriosis, a condition that affects millions of women worldwide. Endometriosis occurs when tissue similar to the lining inside the uterus grows outside of it, often causing pain and other symptoms. Recognizing the early signs is crucial for timely diagnosis and management. In this video, we'll walk through the most common early symptoms, how they might present, and why it's important not to ignore them. Whether you're experiencing symptoms yourself or supporting someone who is, understanding these warning signs can make a real difference. Let's start by exploring what endometriosis is and why early detection matters. Endometriosis is a chronic condition where tissue similar to the uterine lining grows outside the uterus. This misplaced tissue can be found on the ovaries, fallopian tubes, and other pelvic organs. The tissue responds to hormonal changes during the menstrual cycle, leading to inflammation, pain, and sometimes scar tissue. Many women may not realize they have endometriosis until symptoms become severe, but early warning signs can appear much sooner. Understanding what endometriosis is helps us recognize why these symptoms occur and the importance of early intervention. Catching endometriosis early can make a significant difference in managing symptoms and preventing complications. Early diagnosis allows for more treatment options, reduces the risk of severe pain, and can help preserve fertility. Unfortunately, many women experience delays in diagnosis, sometimes waiting years before getting answers. That's why knowing the early warning signs is so important. By recognizing symptoms early, you can seek medical advice and start appropriate treatment sooner, improving your quality of life. Let's look at the most common early symptoms of endometriosis. These signs can be subtle at first, but they often become more noticeable over time. The most frequent early warning signs include pelvic pain, especially during menstruation, pain during intercourse, and unusual menstrual bleeding. Some women may also experience fatigue, digestive issues, or lower back pain. It's important to remember that symptoms can vary from person to person, and not everyone will experience all of them. If you notice any of these signs, it's a good idea to consult a healthcare provider. One of the earliest and most common symptoms of endometriosis is pelvic pain. This pain often starts before or during menstruation and can last throughout the cycle. It may feel like a dull ache or sharp cramps, and sometimes it radiates to the lower back or legs. For some women, the pain can be severe enough to interfere with daily activities. If you notice persistent pelvic pain that doesn't improve with over-the-counter medication, it's important to mention this to your doctor. Early intervention can help manage the pain and prevent it from worsening. Painful periods, also known as dysmenorrhea, are a hallmark of endometriosis. While many women experience some discomfort during menstruation, endometriosis-related pain is often more intense and lasts longer. The pain may begin a few days before your period and continue throughout. It can also be accompanied by heavy bleeding or clotting. If your periods are becoming increasingly painful or are interfering with your daily life, this could be an early warning sign of endometriosis. Another early sign of endometriosis is unusual menstrual bleeding. This can include periods that are heavier or lighter than normal, spotting between periods, or irregular cycles. Some women may notice blood clots or experience bleeding that lasts longer than usual. These changes in your menstrual pattern can be easy to overlook, but they may signal an underlying issue like endometriosis. Keeping track of your cycle and noting any changes can help your doctor make a more accurate diagnosis. Pain during or after sexual intercourse, known as dyspareunia, is a common early symptom of endometriosis. This pain can be sharp or deep and may persist for hours after intimacy. It's caused by endometrial tissue growing near the vagina, uterus, or lower pelvis, which becomes inflamed during sexual activity. If you experience pain during intercourse that is new or worsening, it's important to discuss this with your healthcare provider. Addressing this symptom early can help improve your quality of life and relationships. Lower back pain is another symptom that can appear early in endometriosis. This pain may be constant or come and go, and it often worsens during menstruation. Sometimes the pain can radiate to the hips or thighs. While lower back pain can have many causes, when it occurs alongside other symptoms like pelvic pain or unusual bleeding, it may point to endometriosis. Don't ignore persistent back pain, especially if it's new or getting worse over time. Some women with endometriosis experience digestive problems as an early symptom. These can include bloating, constipation, diarrhea, or nausea, especially during menstruation. Because these symptoms are similar to those of irritable bowel syndrome, IBS, they are often overlooked or misdiagnosed. If you notice digestive issues that seem to follow your menstrual cycle, it's worth mentioning to your doctor. Early recognition can help distinguish endometriosis from other conditions and lead to more effective treatment. Fatigue is a common but often overlooked early sign of endometriosis. Many women report feeling unusually tired, even after a full night's sleep. This fatigue can be caused by chronic pain, inflammation, or heavy menstrual bleeding. It may also be accompanied by difficulty concentrating or feeling run down. If you're experiencing persistent tiredness that doesn't improve with rest, especially alongside other symptoms, it could be related to endometriosis. Pain during bowel movements, especially during menstruation, can be an early sign of endometriosis. This pain may be sharp or crampy and is often mistaken for digestive issues. Endometrial tissue can grow on or near the bowel, causing inflammation and discomfort. If you notice pain or changes in your bowel habits that coincide with your menstrual cycle, it's important to bring this up with your healthcare provider. Some women with endometriosis experience pain or burning during urination, particularly around the time of their period. This can be caused by endometrial tissue affecting the bladder or urinary tract. While urinary tract infections are a more common cause of these symptoms, if the pain is cyclical and occurs with other signs of endometriosis, it's worth investigating further. Early recognition can help prevent complications and guide appropriate treatment. Difficulty getting pregnant can sometimes be an early sign of endometriosis. The condition can cause inflammation and scarring that affects the ovaries, fallopian tubes, or uterus, making it harder to conceive. While not all women with endometriosis experience infertility, it's a significant concern for many. If you've been trying to get pregnant without success and have other symptoms of endometriosis, it's important to discuss this with your doctor. Early diagnosis can improve your chances of successful treatment. Many early symptoms of endometriosis are mild and can be easily overlooked or mistaken for normal menstrual discomfort. This includes mild pelvic pain, slight changes in bleeding, or occasional fatigue. Because these symptoms are common, women may not seek medical advice until the condition has progressed. Paying attention to subtle changes in your body and tracking your symptoms can help you identify patterns and seek help sooner. It's important to remember that endometriosis symptoms can vary widely from person to person. Some women may have severe pain with minimal tissue growth, while others have extensive endometriosis with few symptoms. Genetics, hormone levels, and the location of the tissue all play a role in how symptoms present. This variability can make diagnosis challenging, but being aware of the range of possible symptoms is key to early detection. Keeping a symptom diary can be incredibly helpful if you suspect endometriosis. Note when pain occurs, how severe it is, and any other symptoms like fatigue or digestive issues. Tracking your menstrual cycle, bleeding patterns, and any changes over time can provide valuable information for your healthcare provider. This record can help identify patterns and support a faster, more accurate diagnosis. If you're experiencing any of the early warning signs we've discussed, especially if they're persistent or worsening, it's important to see a healthcare provider. Early evaluation can help rule out other conditions and start the process of diagnosis. Don't wait until symptoms become severe. The sooner you seek help, the better your chances of managing endometriosis effectively and maintaining your quality of life. Diagnosing endometriosis can be challenging because symptoms often overlap with other conditions. Your doctor may start with a detailed medical history and physical exam. Imaging tests like ultrasound or MRI can help identify abnormal tissue, but the only definitive diagnosis is through laparoscopy, a minor surgical procedure. Early recognition of symptoms can prompt your doctor to investigate further and reach a diagnosis sooner. Certain factors can increase your risk of developing endometriosis. These include having a family history of the condition, starting menstruation at an early age, short menstrual cycles, or heavy periods. Other risk factors include never giving birth or having higher estrogen levels. Being aware of these risk factors, along with early symptoms, can help you and your doctor make informed decisions about your health. Even in its early stages, endometriosis can have a significant impact on daily life. Persistent pain, fatigue, and digestive issues can interfere with work, school, and social activities. Some women may feel isolated or frustrated by their symptoms, especially if they're not taken seriously. Recognizing the impact of endometriosis is important for seeking support and advocating for your health. The emotional impact of endometriosis can be just as significant as the physical symptoms. Chronic pain and uncertainty about your health can lead to anxiety, depression, or feelings of helplessness. It's important to acknowledge these emotions and seek support from friends, family, or mental health professionals. Early recognition and management of emotional symptoms can improve your overall well-being. Endometriosis is often misdiagnosed, especially in its early stages. Symptoms can mimic other conditions, like irritable bowel syndrome, pelvic inflammatory disease, or ovarian cysts. This can lead to delays in getting the right treatment. Being aware of the specific warning signs of endometriosis can help you advocate for yourself and push for further evaluation if your symptoms persist. If you suspect you have endometriosis, it's important to advocate for your health. Don't be afraid to ask questions, seek second opinions, or request further testing if you feel your concerns aren't being addressed. Self-advocacy can make a big difference in getting a timely diagnosis and appropriate treatment. Remember, you know your body best. Having a strong support system can be invaluable when dealing with endometriosis. Friends, family, and support groups can provide emotional support, practical help, and encouragement. Sharing your experiences with others who understand can reduce feelings of isolation and help you navigate the challenges of living with endometriosis. Making lifestyle adjustments can help manage early symptoms of endometriosis. This might include regular exercise, a balanced diet, stress management techniques, and adequate rest. While these changes won't cure endometriosis, they can help reduce the severity of symptoms and improve your overall well-being. Talk to your healthcare provider about strategies that may work best for you. There are several medical treatments available for endometriosis, especially when caught early. These include pain relievers, hormonal therapies, and in some cases, surgery. Early intervention can help control symptoms and prevent the condition from progressing. Your doctor will work with you to develop a treatment plan tailored to your needs and symptoms. Hormonal therapy is often used to manage endometriosis symptoms. Medications like birth control pills, progestins, or GnRH agonists can help regulate or stop menstruation, reducing pain and slowing the growth of endometrial tissue. Hormonal treatments are most effective when started early, before extensive tissue growth or scarring occurs. Managing pain is a key part of early endometriosis treatment. Over-the-counter pain relievers like ibuprofen or acetaminophen can help with mild symptoms. Heat therapy, such as heating pads or warm baths, may also provide relief. For more severe pain, your doctor may recommend prescription medications or other interventions. Early and consistent pain management can help maintain your quality of life. In some cases, surgery may be recommended to remove endometrial tissue and relieve symptoms. Laparoscopy is the most common surgical procedure for endometriosis and can be both diagnostic and therapeutic. Early surgical intervention can help prevent further tissue growth and reduce pain. Your doctor will discuss the risks and benefits to determine if surgery is right for you. Some women find relief from early endometriosis symptoms through alternative therapies. These may include acupuncture, physical therapy, or dietary supplements. While research on their effectiveness is ongoing, some women report reduced pain and improved well-being. Always consult your healthcare provider before starting any alternative treatments to ensure they are safe and appropriate for your situation. Regular follow-up with your healthcare provider is essential for managing endometriosis. Early symptoms can change over time, and your treatment plan may need adjustments. Follow-up visits allow your doctor to monitor your progress, address new symptoms, and ensure you're getting the best care possible. With early detection and proper management, many women with endometriosis can lead healthy, active lives. While the condition is chronic, symptoms can often be controlled with a combination of medical treatment, lifestyle changes, and support. Staying informed and proactive about your health is the best way to manage endometriosis in the long term. There are many myths and misconceptions about endometriosis. Some believe it only affects older women, or that severe pain is just a normal part of menstruation. In reality, endometriosis can affect women of all ages, and severe pain is not normal. Dispelling these myths is important for raising awareness and encouraging early diagnosis. Raising awareness about the early warning signs of endometriosis can help more women get the care they need. Sharing information with friends, family, and your community can break down stigma and encourage others to seek help. The more we talk about endometriosis, the easier it becomes to recognize and address the condition early. There are many resources available for women with endometriosis. Support groups, online forums, and advocacy organizations can provide information, emotional support, and practical advice. Connecting with others who understand your experience can make a big difference in coping with the condition. Open communication with your healthcare provider is essential. Be honest about your symptoms, how they affect your life, and any concerns you have. Don't hesitate to ask questions or request more information. A strong doctor-patient relationship can help ensure you get the care and support you need. Before seeing your doctor, prepare a list of your symptoms, questions, and any relevant medical history. Bring your symptom diary if you have one. This preparation can help make the most of your appointment and ensure all your concerns are addressed. Being organized and proactive can lead to a more accurate diagnosis and effective treatment plan. When discussing endometriosis with your doctor, consider asking about the possible causes of your symptoms, available diagnostic tests, and treatment options. You might also ask about lifestyle changes, support resources, and what to expect moving forward. Having a list of questions can help you feel more confident and informed during your appointment. Documenting your journey with endometriosis can be empowering. Keep records of your symptoms, treatments, and how you're feeling over time. This documentation can help you and your doctor track progress, identify triggers, and adjust your treatment plan as needed. It can also serve as a reminder of how far you've come. If you've experienced early warning signs of endometriosis, consider sharing your story with others. Your experience can help raise awareness, encourage others to seek help, and reduce the stigma around the condition. Every story matters and can make a difference in someone else's journey. Research into endometriosis is ongoing, and new treatments and diagnostic tools are being developed. There is hope for better management and even a cure in the future. Staying informed about advances in endometriosis care can help you make the best decisions for your health and well-being. To recap, the early warning signs of endometriosis include pelvic pain, painful periods, unusual menstrual bleeding, pain during intercourse, digestive issues, fatigue, and sometimes infertility. These symptoms can be mild or severe and may come and go. Recognizing these signs early and seeking medical advice can make a significant difference in your health outcomes. If you recognize any of these early warning signs in yourself or someone you care about, don't hesitate to take action. Early intervention is key to managing endometriosis and maintaining your quality of life. Reach out to a healthcare provider, track your symptoms, and seek support. Remember, you're not alone, and help is available. Thank you for joining us to learn about the early warning signs of endometriosis. By staying informed and proactive, you can take control of your health and support others on their journey. Remember, early recognition and action can make all the difference. Stay healthy, stay aware, and don't hesitate to seek help if you need it.